Now, the authorities of Terewode Women's Community Hospital in Soroti have raised concern over the rising cases of obstetric fistula in their facility among young mothers. The facility has registered most of the cases who are young girls aged 18 and below, and it has been partially attributed due to the impact of the lockdown.
Terewode Women's Community Hospital in Soroti is burdened with the treatment of obstetric fistula that often occurs when women are neglected during labor.
The main condition we treat at the hospital is obstetric fistula, which usually is an adverse effect of neglected labor. And the patients usually present to us with urinary leakage after delivery. This usually occurs either immediately or a few weeks after delivery.
This is the condition that prompted government, together with the development partners, to establish Terewode Women's Community Hospital in Soroti to repair the urinary linkages.
Terewode has existed now for 20 years, campaigning against obstetric fistula and improving maternal health. And 2 years ago, we opened up Terewode Women's Community Hospital, which is dedicated in providing obstetric fistula care and in a holistic way.
However, the facility is overwhelmed with obstetric fistula cases registered among the young mothers of 18 years below.
And we are seeing a trend of increasing fistula cases amongst the young, that is women below 18 years. This may be attributed due to the lockdown when schools have been closed, but we are seeing a rise in teenage mothers with obstetric fistula.
The report by Terewode has indicated the traumatizing challenges faced by the fistula victims in the community.
And some of them fear the stigma that's associated with utilization of family planning services, especially given their young age. Most of them, from the study findings, are still living with parents, desiring to live with their parents, desiring to be loved once again by their parents. Others are struggling, constantly working to reunite with the men, their partners, the men who made them, who impregnated them. They still want to live with them. They want to stay in those marriages for some of them. But how are they going to reunite if we do not integrate extensive health education?
Terewode registers more than 300 cases of obstetric fistula, which they say it should be brought to the government's attention before the situation worsens. Okou Joseph compiled the story.